Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, what is causing your hip pain? Is it bursitis? How to know? So let's get to it, Brad.
Yeah, bursitis is one of those terms that I think people, it's misunderstood, and it's a little more frightening until you know what it really is.
So a bursa, just not bursitis, a bursa is a fluid-filled sac. And it cushions the bones and the tendons and the muscles around joints.
Right, they kind of lubricate the tendons and the ligaments from getting wore out over the bone, and you have them all over your body.
Right, exactly, especially over all the joints.
Right.
And the most common bursitis in the hip is trochanteric bursitis. So this is the greater trochanter, and if you want to picture, I got this squishy ball. You can just picture a bursa. This would be way bigger than that.
Yeah, they're more like
smaller.
they're more like a pancake shape.
Sure, but you can see how this fluid-filled ball would kind of protect the bone and protect muscles would be running over this and tendons so they don't rub against the bone and tear.
Right.
So that's what a bursa is. So when it gets inflamed, then it becomes bursitis. So very easy to understand.
So itis means inflammation, simply.
So yeah, this is trochanteric bursitis. It would be so it's right on the point of your hip. So generally, how you can hurt this is through a number of ways. One could be just a direct injury. You could fall on it.
Yes.
Something could bump up against you, hit you really hard there. But you can also get it from just putting stress on it over a period of time.
You know, I think some people may have their gait changes or walking changes because of an injury. Maybe they have something with their ankle and they sprain their ankle, so they start walking funny until it gets better.
Yeah, why don't you show what like a Trendelenburg walk is, Brad?
Sure, Trendelenburg, where you kind of do this kind of thing.
Yeah, and it might just be one way.
Right.
If you're weekend.
Just to the left. Or you might see people do this to the right and to the left, and there could be a number of reasons for that.
But I always think, Brad, that can lead to bursitis.
Sure.
Because you're putting a lot more stress on those muscles and tendons that go over the...
In a movement that's not intended to be.
Right. So you can have the direct injury. You can just get it from lying on it for long periods of time. My hip, actually, for a while, got sore because of the muscles around it, but I couldn't even lie on it.
Oh, really?
Yeah. I had to avoid lying on it.
You had to sleep on the floor because your wife kicked you out of the bed.
No, that wasn't it. But I did have to lie on my other side. So
okay.
Repeated stress. So like if you're running or stair climbing or bicycling, it could cause it. Poor position of the hip, like with standing, walking, or sitting. So let's say standing. Let's say you always stand like this.
Yeah.
You know, this hip is taking more stress.
Yep.
This hip is taking no stress. And if you do that year after year, and especially when you get into the elder years, as Brad and I have found out, these things start causing pain. Another one is, we already talked about the walking, but some people sit on one side too. I mean, I actually kind of sit like this when I'm eating, and I don't know, it's bizarre. But
it's one of those things that develop for who knows why.
Kind of try to find a stable position.
I do want to mention, you mentioned bicycling, and if you do get it from bicycling, it's probably because your seat's not adjusted properly.
Correct.
It's probably too low. And that can go with other things too. It's just something not done properly or ergonomically correct, if you will.
Right. If you have medical conditions like gout or RA, pseudo-gout, that can certainly cause it. Previous surgery, including hip replacements.
Sure.
Get it. Bone spurs or calcium, especially if they're on the tendons that attach to the greater trochanter.
Yes.
Those spurs can actually dig into that bursa.
That makes perfect sense mechanically.
If you have a leg length discrepancy, if one of your legs is longer than the other, so that's going to kind of put you in that position where you're going to put more pressure on one hip. That can certainly cause it. In that case, you might want to correct it and put a small lift in your shoe.
Right.
Rarely an infection causes bursitis. I think I've seen a case like that one time.
Did you?
Yeah, that was interesting. So do you have it? Let's answer that question, Brad.
Yes.
It's more common in women. Definitely more common as the middle-aged or elderly. You don't see it in young people very often. I don't think I've ever seen it.
Right.
Pain is on the outside of the hip. Now we say outside of the hip. Might be the side of the hip for some people.
Yeah.
You know, because we always talk about this, Brad, that when people ask them where the hip pain is, what do? They'll point here or back here.
Yeah, or a lot of time they think the pelvis bone is the hip
Yeah.
up here, that ilium.
Right,
actually,
right, way up.
Where
up
actually
higher.
they're a few inches too high.
So pain on the outside of the hip, pain with line on the hip. That's a big one.
Yep.
Pain with getting up from a low seat or a chair.
Yep.
And pain with the use of stairs again, which is
Sure.
real common. The single best test, and this is going to probably be disappointing to a lot of you, is simply to, like, let's say the bursa is right here. You're going to find that bone and press on it.
Right.
And see if it's tender right over the bursa. Now, you might feel some swelling, you might feel some warmth, but generally the pain is right over that bone. Brad's going to show you kind of a way to find that bone, right?
This is the way I have my patients do it, and this is the way I pretty much do it too. I'll have them, you can do it lying down. I usually do it standing, and then I say, put your foot out so your toe is touching on the floor, and rotate back and forth. You know, this is what, you know, I don't know, it's probably not politically correct, but like I throw a cigarette on the ground, you're going to smash it out.
Right.
Both my parents smoked when I was young, and it was like one of those things.
That's what they did all the time.
And they taught us that in PT school back in the 90s. But when you do that motion and you put your finger right here, you're going to feel that greater trochanter rotate very clearly.
You feel it under your fingers.
Yep.
Kind of moving.
Exactly. And it's one of those places where if you're a heavier person, you can just push in there and you'll still feel that distinct trochanter. It's right there.
Yeah.
And it typically does not it has no muscle over it, and not a lot of fat tissue will go over that as well.
Right.
It will, but you just push through. You'll get there.
You got tendons and you got the bursa. So,
Yep.
This beware though. This is often misdiagnosed, Brad.
Sure.
And quite often it might be a muscle or tendon tear, and that would act the same way. You know,
Right.
if a tendon is tore right over the
Yep.
trochanter,
Yep.
it's going to feel the same. Irregardless, you probably treat it fairly similar.
That's what I was thinking too. It's a different diagnosis, same area, similar treatment.
Although I would maybe try massage to a tendon, a muscle, and I wouldn't do that to a bursa.
Right.
So.
That's true.
All right, remember this. This is part of a program, a series of programs, a series of videos on hip pain.
Yes.
So if you go to bobandbrad.com and go to our program section, look under and you'll find one on hip pain.
Yep.
We've got about, 25, 30 videos on this, I believe we got. And just look at the ones that you think will be helpful to you.
Look at the titles. You certainly don't have to look at them all. I mean, if you want to, you can, but you'll find that the titles that say, yeah, I think that's going to fit me. Look at it. There's a PDF printout on all of them, so you can print out the video so you don't have to go back and look at it. You got a nice...
portable digital format? Is that what we decided?
Yeah, the PDF, that's what that stands for. And then you have something on paper to refer back to.
And this is all the way, by the way, all free.
Right.
This is Brad and I's goal of we're trying to help as many people in the world as we can.
Yep, and this is a service. We don't even ask for your email.
Thanks for watching.